All right. Because everyone's time is precious, we'll get started on time here. So good afternoon, everybody, and welcome once again to another Garfunkel Wild webinar. This is another part of our compliance webinar series. Really proud to bring these to you on a monthly or nearly monthly basis where we're discussing timely issues in compliance, whether it's here in New York or in other jurisdictions. Today, we have a great topic for you. We have the New York State OMIGs general, 2024 work plan. And it's been some time, right, before we've seen one of these, and we thought it was a great opportunity to come out here and discuss it with you all. I have great panelists who are going to be with you today and talking about it. I have Andrew Coe, who sits in our Albany office. He's a terrific associate here at Garfunkel Wild, and I have Vanessa Giunta, who sits here in Great Neck, another associate in our compliance group. And I'm going to turn it over to them for what will be a great discussion. So thanks again, and take it away.
Welcome, and we look forward to getting started. As Rob stated, it has been quite some time since OMIG has released the work plan. This is the first work plan since the 2019 to 2020 work plan. It's not an exhaustive list of all the activities that OMIG will conduct throughout the year, but it does provide a good roadmap and the areas of focus for the year. Interestingly, if you look at this work plan compared to the prior editions, OMIG deviated from the formatting and they actually took away the goals. There used to be enumerated goals listed on the work plan, but here instead it's more focused on different areas and topics. And as always, OMIG invites input from stakeholders, so it's important after reviewing the work plan, if you have areas of concern or clarification that needs to be provided, to contact OMIG, and you'll see on the screen the email address that you can use to contact OMIG regarding the work plan. The OMIG's areas of focus for the 2024 work plan include the following: compliance program reviews, which our department has handled a handful of them, and this is a hot area right now. Self-disclosures, healthcare worker bonus program, provider audits, third-party liability match, recovery audit contract reviews, investigations, system match, pharmacy and drug diversion, and collections. Other areas of focus which are listed in the work plan include Medicaid managed care audits and estate and Medicaid lien reconciliations, which we will not touch upon today.
And before you move that slide, Andrew, just so everyone's aware, just because they didn't issue the work plan doesn't mean these things haven't been going on for quite some time. And I can tell you firsthand, these compliance program reviews have been coming in. We've been handling a number of them for clients, and they keep coming in. They're touching a variety of different client and provider types. So we're seeing a variety of providers. It looks like they're taking a sample. It looks like they're going in and taking a look at the compliance programs, making sure that you're up to date for those of you who are mandatory compliance program providers. And they're looking at it. They're taking a look back. Usually they're looking at the last quarter of last year. And this is kind of a hot thing happening right now. So I know you'll talk about it later. But that is one where, we certainly suggest if you're not in line right now, you better get in line. And certainly the third-party liability match, that was another one that had been going on for some time. And some of these other ones have obviously been as well. Sorry for the interruption, Andrew.
Oh, thank you for the addition. So what can you expect for the compliance program reviews? The OMIG will continue to conduct their compliance program reviews. It commenced last July, and it's really to make sure that your compliance program is meeting the regulatory requirements of the 521 regulations. And the reviews are for a retroactive period, as Rob had stated. For example, in July, they looked at April to June of 2023 to make sure that you had an effective compliance program. So how do you know you're being notified? OMIG will send you a notification letter which directs you to get the compliance program review module from their compliance library website. This website is a great resource both for providers and for the compliance team for your organizations. It includes a wealth of resources that can be used, and if you have questions about it, our team at Garfunkel, we're very familiar with the resources available. So Once you get the notification letter, you have 30 days to complete the review module and include the requested documentation. After documentation is received, OMIG will review it, and if there's any missing documentation, providers have received a letter requesting more information. The time frame for responding is tight. You are provided initially with 7 days to collect that documentation, complete the review module and update it, and then resubmit it. The components of the review module include completing the questions, gathering the responsive documentation, and this includes all effective versions during the review period. So if you made updates to certain compliance policies, it's important that you're tracking the effective dates in order to properly respond to the review. In addition to submitting documentation, you also will have to complete the provider documentation table, which really lays out the roadmap for OMIG to go and take a look at your documentation so they know exactly what you're looking at and which element in the compliance review module the document is responsive to. The review module has very specific questions for each part of the Part 521 regulations, which require you to gather documentation and submit the documentation in order to support the responses to the questions. You'll see on the slide, this is an example of a question directly from the review module. The provider documentation table is included at the end of the compliance program review module, and it requires the completion, which includes the name of the document, the related attachment number, which you'll get from the questions in the compliance review module, and then you'll have to include the effective dates for the documentation. And importantly, if there's no responsive document in the tables, you have to list that one does not exist. For example, you'll see the sample, the second line, it says do not have. This is important to indicate in the table, or else OMIG may reach out with that letter requesting more information.
Look, Andrew, we've already seen it. Like, if you don't fill out this form and we've seen clients come to us after the fact who need some help. But if you're not going to sit there and take the time to fill this out, it's getting bounced back to you. That's the bottom line. They're sending it back and they're saying this all needs to be completed. They want this laid out for them so that they can go through it very quickly.
Right, and then you're giving a shorter time frame in order to complete it. So what are the outcomes that you can expect once your compliance program is reviewed? The results will be provided in a written compliance program assessment, and in response to the assessment, providers should identify and implement corrective actions in all areas identified by the OMIG as needing improvement. And we're certainly willing to work with providers together in order to address any areas that need help. As far as the metrics for the compliance program reviews, a score will be provided per month for each question, and then an average score for each month of the review period will be calculated. And at least 60% is a satisfactory score. If a provider scores less than 60%, there may be a monetary penalty, which I'll touch upon next. So why is this important? What are the consequences of not having an effective compliance program? The consequences include monetary penalties up to $5,000 for each month the provider fails to adopt, implement, or maintain an effective compliance program. And this amount may be increased to $10,000 per month for a second violation. This just shows that this is going to be a continuing area of focus for OMIG and that they can come back and audit the compliance program again. Also, there can be recoupments of monies paid to the provider during the period in which it did not have a compliance program, termination of enrollment in the Medicaid program, or sanctions up to and including exclusion from participation in the Medicaid program. I see a question. So the question is the provider documentation table in OMIG's self-assessment form? It's not in the self-assessment form, but it is in the review module. It's on page 39 of 39. So what can you do in order to be prepared? providers should ensure that they have an effective compliance program in accordance with the regulations. You should make sure that your compliance program is up and running, that's effective, and all of your policies and associated documentation is meeting the regulatory requirements. The self-assessment form and review module are available on the compliance library section of OMIG's website, and we're happy to work with providers to answer any questions and to make sure that you have an effective compliance program. The review module requires providers to gather documents in response to the questions, and the documents that you submit have to be in a searchable format. The requests within the review module include, but are not limited to, the compliance program policies and procedures, results of audits of risk areas, and exclusion checks.
Hey, on here, just a reminder, it's time to get yourself in order on this. The regulations are OMIG's, newest thing in years. And they're out there. It really laid out those kind of minimum standards for compliance programs. It shouldn't be, in a binder collecting dusts. Make sure you're hitting all the elements. Make sure you've got that anonymous method for reporting. Make sure it's effective. You're doing those audits. And if you're not, it's time to, to kind of get the dust off and dig in, because we keep seeing these more and more. So this is obvious that it's new and they want to enforce it, and they're going to make sure everybody is on board.
Right, and really to prepare, you want to make sure everything's in order, exactly as Rob had stated. You want to make sure everything's updated, but in addition to that, to make it so that you're proactively taking steps to make sure you're prepared if you do get audited, you want to make sure that all of the material is organized and that you're tracking the documentation. You want to make sure you have the effective dates readily available. If you're updating policies, you want to know where all the versions are. It's very important to make sure that you're organized and that all of this is readily available. The next topic we'll discuss are self-disclosures in the 2024 work plan. So providers are required to report, return, explain any overpayments they've received to the self-disclosure program within 60 days of identification by the date of any corresponding cost report was due, or by the 60 days after discovery, whichever is later. And an overpayment is considered identified when a Medicaid entity or provider has or should have, through the exercise of reasonable diligence, determined that Medicaid fund overpayment was received and that they have quantified the amount of the overpayment to the best of their ability. We've worked on plenty of these matters before. We understand the difficulty that can come about from getting old claims information. So the standard for the quantifying the amount, it's a reasonable standard, and we're happy to work with providers in order to get the amount identified. Once the Medicaid entity or provider has submitted a self-disclosure statement, OMIG may reach out and request additional information from you. There are two different types of self-disclosures. You have the full self-disclosure statement, which has been around for years, and examples of information that can be disclosed using the full self-disclosure statement include, but they are not limited to, any error that requires a provider to create or implement a formal corrective action plan, actual, potential, or credible allegations of fraud behavior by employees or others, discovery of an employee on the excluded provider list, documentation errors that result in overpayment, overpayments that result from software billing system updates, systemic billing or claim processing issues, non-claim based Medicaid overpayments, any error with substantial monetary or program impact, and any instance upon direction by OMIG. I see a question in the chat, and it says, don't the providers have to do this now all online? Yes, this is available online. There is a specific link on OMIG's website for the self-disclosure processes. The OMIG also implemented a second pathway for self-disclosures in August of 2023. So now you have a abbreviated self-disclosure process, which is helpful because there are countless times where clients are reaching out with smaller issues and Without this being previously available, you would have to go through the full self-disclosure process, even for small routine errors. And this information is all available on the self-disclosure website as well. The second pathway allows for the reporting and explanation of voids and adjustments where the error had minimal monetary or program impact. Examples of when this should be used are routine credit balance and coordination of benefits overpayments, typographical human errors, routine NAMI adjustments, instances of missing or faulty authorizations for services due to human error, instances of missing or insufficient supporting documentation due to human error, inappropriate rate procedure of fee code used to typographical or human error, or routine recipient enrollment issues. The abbreviated self-disclosure process includes an abbreviated statement, which is available at this link, and the submission also requires that you upload a fillable spreadsheet. The overpaid claims are voided and adjusted within 60 days of identification and added to the statement form. The OMIG wants the submissions to be aggregated in a monthly report, which will be submitted by the 5th of the month following the month in which the claims are voided or adjusted. So this is an ongoing requirement. As it's being discovered, you want to make sure that you are comfortable with the process, and us as attorneys at Garfunkel Wild, we're comfortable in answering any questions or helping you through this process. Importantly, when an abbreviated self-disclosure statement is submitted, the OMIG will not contact the disclosing party unless it needs more information. In the instance where more information is requested, the disclosing party will have 15 days to supply any additional requested information. You'll see on the screen a screenshot of the abbreviated self-disclosure statement. This is available on the website, and this is the background information which will need to be inputted into the OMIG uplink. In addition to filling out the background information, the abbreviated self-disclosure will require you to fill in the spreadsheet, which includes a overpayment summary, and then the void and adjustment data as well. Another aspect of the self-disclosure statement, which was recently updated, is the self-disclosure process for damaged, lost, or destroyed goods. And in the past, it was difficult to determine exactly what to do under these circumstances. Now there's a formal process in contacting the self-disclosure unit and filling out information to make sure that it's on record. The disclosure should be made as soon as practical, but no later than 30 calendar days following discovery. If the records are requested upon audit or investigation, OMIG will evaluate statements of damage, loss, or destroyed records and determine on a case-by-case basis whether there are mitigating circumstances for the failure to maintain these documents. This is really important because upon audit, this could have a significant financial impact if the claims were to be extrapolated.
Yeah,
So
on this one, just on this one, we've seen this come up, and we're seeing it more and more. We've had a few cases where we're in the middle of an audit and the client is coming at us and saying, "Hey, we had a leak," or "Hey, the audit period is for a time that's covering." They had paper charts, or we had a data breach, and we had these things. And if you're not going and reporting them, it's going to become a lot harder to get any credit during the audit. And when we responded with some of those, or the client responded, with some of that information, that was the first thing that OMIG pointed to during the audit. So this is an important one. Between this and the abbreviated disclosure, those are kind of the newer pieces that we've seen, from OMIG and that they're focusing on. Not surprising then to see it in the work plan.
we have a question: do damage, lost, destroyed goods have to be reported retroactively if the audits are covering previous fiscal years?
I think what the question. I mean, the OMIG obligation, as it's stated, is, if I remember reading, is you have a duty to report that. I'm not sure if it doesn't mean it's tied to your audit. It's a separate and independent duty to report, not in the middle of an audit. Do you have an obligation to do this? You'll get yourself, in a little bit of a bind if you hadn't reported it by then, unless you're just figuring it out.
Right. To Rob's point, you want to be proactive when records are damaged, lost, or destroyed. You want to move swiftly and report it to the OMIG so it's on file. Then, if you do get audited, there is that paper trail of you contacting OMIG.
Just as a housekeeping measure, if you don't mind, um, if you can put the questions just in the Q&A, only because we actually get a transcript of that when we're done, and if we can't answer something or we get a question that shouldn't be kind of, answered um, more to the public, we'll have a transcript when we're done, and we can maybe reach out and answer it for you. The other thing, and I posted it in the chat, I usually get the question, is this being recorded? Will I get a copy? The answer is yes and yes. So we're going to record, this is being recorded. We'll send it out. When it's done, it usually takes a day or so, and you'll get a recording, and you'll get the slide deck. And if you're not on here and you're registered, those folks will get it too. So thanks.
All right, and the next area of focus for the 2024 work plan is the healthcare worker bonus program. This program allocated $1.3 billion for the recruitment, retention, and reward of certain healthcare and mental hygiene workers who met eligibility requirements. And employers who receive an overpayment for the healthcare worker bonus funds are now required to report, return, and explain the overpayment to OMIG. There's a separate self-disclosure process for this, which includes similar statement, certification, and a spreadsheet which must be completed and submitted. After submission, OMIG's self-disclosure unit will contact the provider with a project number for reference, and then they may request additional information to complete the processing of the disclosure. At the conclusion of its review, OMIG will issue a final letter which includes instructions on how to make the repayment. Now I'll turn it over to Vanessa for the provider audits.
Yeah, I'm going to take over just detailing a number of the other focus areas that the work plan included. So provider audits are going to remain an area of focus for OMIG in 2024, and they plan on continuing these activities with a particular focus on nursing homes and assisted living programs. So with that said, the 2019 audit period for minimum data set reviews, or MDS, will begin this year as well. For some background on that, MDS is a tool used by nursing homes to evaluate each resident's needs and develop a plan for services, and then which become part of the calculations for the direct cost portion of a facility's Medicaid rate. There are some new focus areas and updates for 2024, and they are going to include the publication of audit protocols for the Office of Mental Health Personalized Recovery Oriented Services, or PROS, the Office of Mental Health Telehealth Services Protocol, and the OPWDD Community Habilitation Protocol. OMIG provides a web page with access to its audit protocols that providers can view and download at the link that we've included here on the slide. These audit protocols are released by OMIG, and you can use them as guidance. They're meant to assist providers in developing programs to evaluate compliance with Medicaid requirements under federal and state law. But we do note here that while they are very helpful, the protocols don't encompass all current requirements for payment of Medicaid claims. So they should not be used as a substitute for a full review of statutory and regulatory law that has to be followed. So with respect to some of the 2024 auditing activities in the work plan, long-term care services will be among this year's focus areas. OMIG plans on performing nursing home rate audits of cost and data related to capital calculations and ancillary services, provided a little bit of background about what that is. They also plan to review the accuracy of MDS submissions for selected nursing homes. As we mentioned before, they'll be starting the 2019 audit during this year. And lastly, in this area, they plan to continue auditing adult day healthcare and assisted living programs. So home health, and community-based services will be yet another focus area this year. OMIG plans to perform audits on diagnostic and treatment centers, certified home health agencies for payment made via the episodic payment system, or EPS. A little bit of background about that there. Personal care aides, licensed home care services or agencies, or LICSAs, and independent providers for private duty nursing. Nursing home transition and diversion waivers, or NHTD. A little bit of background on NHTD there. And consumer-directed personal assistance programs. So yet another focus area will be on behavioral health and addiction services and person-centered services and support. So there will also be, new areas introduced for auditing activities this year. But again, we're awaiting these publicly shared audit protocols, which again are for OMH pros, which a little bit of background on pros there. OMH telehealth services, which we do note here that OMH has published guidance that the use of telehealth technologies to provide mental health services at a distance will still include all the regulatory requirements applicable to providing mental health services to the same extent as they're provided in person to telehealth services. And then lastly, audits of OPWDD, community rehabilitation, and a little bit of background. This provides one-to-one training to people with intellectual and developmental disabilities in these different and various settings. So here again, we just note that while these new audit areas were listed in the 2024 work plan, and while OMIG does provide a page to access the protocols, we still have not been able to see any publicly available audit protocols for these services yet this year.
Right, and I can tell you, like, this is a continuation, as you and Andrew both know, but we've seen the OPWDD more frequently in the last year or two as well. So it's not a surprise that they've kind of listed here, and the OMH as well. So we're not kind of surprised given what we've been seeing trending in the industry.
So something we've also been getting a lot of is pharmacy work. So pharmacy will continue for OMIG to be another area of focus. They're going to be auditing to ensure compliance with existing Medicaid regulations and ensuring appropriate authorization of payment, specifically for controlled substance claims. The available audit protocol for this focus area includes criteria related to controlled substance claims, and they're going to be looking for things like whether there are original prescription fill dates beyond the allowed time frame, invalid fax orders, missing DEA numbers, claims billed in excess of supply limits for emergency prescriptions, and prescriptions missing the pharmacist's endorsement. OMIG plans on continuing also to conduct fee-for-service pharmacy audits in addition to the above. So moving on to third-party liability matches, this continues to be another focus area for OMIG, and it applies to all Medicaid providers. So it's an area of focus primarily because Medicaid is generally intended to be the payer of last resort. So it's meant only to be used after all forms of insurance coverage have been exhausted, although we note there are some exceptions here, such as for prenatal preventative care, good cause recipients, and a few others. But if the state determines that Medicaid benefits could have been covered by a third-party payer, then the state may end up recovering the payment through subrogation for up to 3 years after the services are rendered. And in these cases, the state uses two approaches to ensure that the application of third-party coverage was applied. So this includes claim processing edits, including the Medicare crossover process, and post-payment reviews and audits and recovery, which means that recovery attempts are made by sending Medicaid reclamation claims to insurance carriers or by engaging directly with the provider themselves.
Yeah, so just a little color there. We saw, maybe some of you are also on here, experienced it as well, contracting with, I think you'll mention it somewhere in here, Gainwell or another, third party to assist them, where they're just going in, they're data mining, they're looking at the beneficiaries, and we've handled a lot of these with success, but we see them continuing. And if you do not know what the process is and what you need to maintain in order to justify your billing, I mean, they'll go dig into the system and check to see whether the provider checked the system, to see if if the Medicaid beneficiary either had Medicaid on that day or had another payer available. And they'll look at those audit trails in order to try to recoup monies. And we've seen some substantial demands out there. So I encourage you, if you're not familiar with this, you can go into the Medicaid manual and take a look at it so that you get into compliance ahead of time. It's not good enough for the beneficiary just to show up with a card and show you the card. I know most of you know that, but in case you don't, take a look.
So turning to recovery audit contract or RAC reviews. So a little bit of background, the Affordable Care Act requires Medicaid agencies to contract with RAC contractors to reduce improper payments. And they do this through detection and collection of overpayments, underpayments, reporting suspected fraud or criminal activities, and to implement actions to prevent further and future improper payments. So to do this, OMIG contracts with a company called Gainwell Technologies, also known as Health Management Systems, and they plan on continuing to work with this contractor, providers themselves, and CMS's Unified Program Integrity Contractor, and they do this to accomplish these goals primarily using tools such as claim selection, improper payment recovery, underpayment identification, same thing for overpayment, and then the self-disclosure recovery process. So to detail some of these tools used a little bit further, we're highlighting detection and collection tool number 1, which is claim selection and improper payment recovery. So here, OMIG's contractor will work to identify providers that have received erroneous, duplicative, or incorrect payment amounts, non-covered services, incorrectly coded claims, reimbursement errors, both excessive and insufficient, coverage or eligibility errors, or payments made for services not ordered or otherwise rendered or performed, or just that are otherwise ineligible under the laws and terms of the Medicaid program. And these identifications may be determined via what's called an automated review, which is determined at a system level without any human intervention or human review of the medical records. Or they can use a complex review, so that does involve a human review of medical records, vendor records, and any other supporting documentation. In the second tool that they will use, which is under and overpayment identification, OMIG's contractor will review each claim line and consider all of the possible occurrences of an underpayment. So this applies to all provider types. So providers will be informed of the underpayment, and then they will be asked to sign an OMIG approved agreement form, and that will be sent to OMIG, and providers are then the responsible party for the recovery of those underpayments. However, for overpayments, the process is a little bit different. There's a preliminary findings letter that will be sent to the provider, which details each claim line and discrepancy, and then providers can submit additional documentation about the discrepancy. Providers are then sent a final letter with the results, and if the provider agrees that an overpayment was found, then they can repay using a check or use a void or an adjustment method of the claims through the Medicaid Management Information System. And the last collection tool is self-disclosure recovery, where providers are required to self-disclose overpayments within 60 days of identification of those overpayments. So moving on to investigations, the work plan says that OMIG will continue to conduct on-site and remote credential verification reviews, or CVRs, of a provider's place of business. And this is to determine overall compliance with Medicaid requirements. So CVRs are used to assess areas such as the provider and staff identification and credentialing, physical attributes and conditions of the place of business, including health and safety issues, record-keeping protocols, and procedures regarding Medicaid claiming. And they're conducted at sites, for example, physician and dental offices, pharmacies, which we've gotten a lot of durable medical equipment retailers, and even part-time clinics. And we note here that while CVRs apply to all Medicaid providers, the work plan itself highlighted a specific example, interestingly, in which OMIG plans to continue conducting CVRs and collaborating with state partners, and they mention these different departments. So Department of Motor Vehicles, Medicaid Fraud Control Unit, and the Department of Transportation in individual counties. to focus on Medicaid transportation providers and their adherence to DOH transportation manual requirements specifically. In the most recently available OMIG annual report, so that's from 2022, OMIG investigation staff used CVRs to educate providers on Medicaid guidelines and then also gather information on staff credentials and training, service delivery, storage of pharmaceuticals and medical supplies, evaluate the physical layout of businesses, go through record-keeping protocols and the claiming practices. And since 2020, a portion of these reviews were conducted remotely through telephone, video, or photographs. And in 2022, the majority of CVRs, 92 of them, were of transportation and pharmacy providers, which really highlights that focus that they're talking about in the work plan. The 2022 report did not specify the number overall for CVRs that year, but if we're looking at trends in the past years, OMIG completed 202 CVRs in 2019, bumped it up to 365 in 2020, and then again, still pretty high, 286 in 2021. So it just helps to conceptualize and quantify these efforts over the last few years. To provide a little bit more background information on this topic, CVRs are random inspections of provider locations, and they can be initiated as a response to an allegation received through OMIG's fraud hotline or referrals from other agencies, and they are tailored to the specific provider type. So it's important to note here that this issue about CVRs, because they can be used to quickly yield additional and/or criminal findings, things like drug diversion, credible allegations of fraud, including false claims and kickbacks, non-compliance with safety standards in transportation. And as we noted earlier, according to OMIG's most recent annual report in 2022, the majority were of transportation and pharmacy. So turning to some other ways that OMIG identifies recoveries, OMIG uses analytical tools, techniques, knowledge of Medicaid billing rules to, as Rob said, data mine Medicaid claims. This is done to identify any potential recoveries of inappropriate payments due to improper claims. And OMIG's anticipated audit project areas for 2024 include physician services in OMH licensed clinics, where they will be auditing to ensure that only the licensed OMH program seeks and receives Medicaid reimbursement. This is because physicians and other licensed clinicians, regardless of how they're engaged by the OMH license program, they may not seek separate fee-for-service Medicaid reimbursement for those services. And in another area called partial hospitalization, where OMIG audits to ensure that partial hospitalization treatment, it's an intensive outpatient treatment program, does not exceed 6 calendar weeks is what they'll be looking for. And then lastly with transportation, OMIG is auditing fee-for-service transportation claims for recipients who were hospital inpatients on the date of service, and then auditing claims for ambulette services. And here they want to be verifying that the vehicle and driver's license numbers were authorized on the date of service. So pharmacies in particular, like we have said, may see some increased OMIG activity and are seeing increased OMIG activity. We highlight this portion of the work plan just to note that OMIG plans to continue conducting pharmacy CVRs to evaluate compliance with Medicaid rules and regulations. The work plan notes that for this year, OMIG wants to continue conducting even more frequent CVRs of pharmacies throughout the entire state. So for a little bit of background here, pharmacy CVRs are conducted periodically, they're unannounced. It can consist of an interview, pharmacy inspection, and then a records review. And some of the key focus areas highlighted for this year with respect to pharmacies particularly are pharmacy ownership, where owners and supervising pharmacists have to ensure their operations adhere to Medicaid requirements, and also include a lack of appropriate pharmacy supervision. They'll be checking for that because it concerns fraud, waste, abuse, safety issues that they're looking for. And just to go in a little bit further about why these issues are so important, findings from CVRs have led to large settlements that OMIG has published, such as those in the case of drug diversion, where here in this example, while conducting a pharmacy CVR, OMIG identified expired empty pharmaceutical bottles on shelves. clear plastic bags containing unknown drugs, which were used to then create the appearance of legitimate inventory. And the pharmacy owner in that case also admitted to buying and dispensing diverted drugs. So here, the Medicaid Fraud Control Unit entered a settlement in which the pharmacy and the owner agreed to pay $76,500 for this violation of the federal False Claims Act and New York State Social Services law. And in another example involving a credible allegation of fraud, during yet another CVR, OMIG found documentation in patient files for kickbacks for certain medications and records of non-dispensed pills billed to Medicaid, and referred the case again to MFCU as a credible allegation of fraud. And they also received in that instance an employee complaint regarding the same. And here they ended up entering a settlement in which the provider, even more, agreed to pay $250,000 in restitution for filing false claims related to Medicaid. So these examples are important because they not only note where OMIG's focus areas are going to be and how they plan to conduct the audits, but also to proactively take measures to be sure that providers, especially in pharmacy, are in compliance with these auditing tools, because it can lead to much larger findings and consequences past just a regular CVR. So moving on to repayment options. So once there is a final audit report that is issued, providers should know that they are provided with two different options for repayments. In option one, providers can make a full payment by check or money order or with OMIG's online payment portal. It has to be done within 20 days of the date of the final audit report. And then in option two, providers can enter into a repayment agreement with OMIG. And if the repayment terms exceed 90 days from the date of that final report, then recoveries of amounts are due, are subject to interest charges that we note here. We also note that if providers want to enter a repayment agreement, then the OMIG Bureau of Collections Management has to be contacted within those 20 days. If a payment option is just not selected within 20 days of the date of the final report, then OMIG will initiate recoupment by withholding all or part of a provider's payments if nothing is chosen. And then lastly, we also would like to note that processes like the financial hardship process application are going to continue to be available, and OMIG on their work plan noted that they continue to engage with stakeholders for provider-friendly projects like these. So if an OMIG audit poses a financial hardship to providers who then must repay these liabilities, the hardship process application is something that gives providers an opportunity to use an extended repayment system when providers cannot afford to repay within the standard timeframe. So here we just note a couple of facts about that. So it's something that providers may want to keep in mind if this is something that they're facing. The hardship process application is not new for this year. It's been available since 2021, but the work plan did highlight these options as a continued commitment to work with providers. So for any providers that have received a final audit report and they're interested in applying and using this process, they're also encouraged through the work plan to contact the Bureau of Collections Management for an application. And this brings our presentation on the work plan to a close. Hopefully this information was helpful, and we're happy to answer any questions you have.
All right. Well, another great job, and you can scroll through yours. We want to thank everybody for joining us today. We'll continue our compliance webinar series here at Garfunkel, and we hope to see you back again. If you have any questions afterwards, feel free to reach out to us. Have a great day, everybody.